I'm back. So now we're going to talk about wounds, and I want to talk to you guys about some different prevention strategies. Today we're talking about positioning, and we're talking about braiding scales. We're going to be talking about fall risk scales. And if you identify that your patient is at high risk for pressure breakdown, there's some things that you as a nurse can do. You don't have to have an order to help prevent it from happening. The first thing is most hospitals are now using some sort of foam. It may not be this brand, it may not be this color. We call this the Angel. She's got wings. This is great for heels. It goes under the foot, up around the sides, and helps prevent pressure to the heels. You can also put it on somebody's backside, right down the cheeks, right on the sacrum, and that'll help prevent a little bit of extra. It's a little bit of prevention for extra pressure to the area. Sometimes they're also in a square, and we have some that are shaped just like a sacrum, and they're great. Studies have shown when these are in use that they really are a good prevention tool for pressure ulcers. But you have other things. A lot of hospitals now have a wedge. This one's a bit old, but you can put this under the sheet under your patient to help position them, especially if you have a patient that already has some breakdown. This is great to alternate the sides, get a little pressure off the sacrum, but you can use this in lots of different ways, lots of different positions to help get pressure off of an area. And then as you're repositioning them every hour or 2 hours, you would switch sides with the wedge. So that's called a wedge. Something else you can use, a lot of places now will have a lovely wheelchair waffle cushion. You've probably seen a waffle cushion before. We have them here that you can actually order from the storeroom and put in the patient. If you have a patient with a wheelchair or somebody that wants to be up in the chair all day, we want to obviously encourage that independence, but we want to help prevent pressure. And the great thing is these are charged out to the patient and they can take it home when they go. A couple of things that we can use to help prevent heel breakdown. We have boots. I think these are Build-A-Boots, or I call them Marshmallow Man boots because they're so big. But they're great. They help prevent pressure, but you can also use it to help prevent foot drop, which is when you have muscle atrophy and the foot tends to do this. So keep that foot nice and flexed, keep it from rolling too much, and help prevent pressure. This is similar, but a little bit of a different type, a little less moonish. You see there's an open spot for the heel, so you still have to be careful, but it does help keep pressure off that calf, off that heel, floats that heel for you, and keeps it nice and flexed. And then the other thing you can use is super sophisticated, a pillow, right? So you can use this under a sacrum, under a leg, under a heel. We positioned somebody this morning that was leaning to that right side, and we put it under their shoulder to help keep them from putting so much pressure. So sometimes it's use what you got, and if that's a pillow, it's still okay. Think about all the different pressure points that their body has and try your best to get some of that pressure off, okay? All right, thanks.